Good afternoon, everyone. I'm Senator Samra Brook. I'm the chairwoman for the Mental Health Committee in the Senate, and I am joined today by Assemblywoman Gunther, who is the chairwoman of Mental Health in the Assembly. And we are here today for the Mental Hygiene Subconference Committee. And I will hand it over to Assemblywoman Gunther for her opening remarks.
So I'm Assemblywoman Aileen Gunther, chair of this conference committee. I am joined by my assembly members, Phil Steck, I think Dee Dee Barrett, Tom Abenanti, Missy Miller, and also as alternates would be Chantel Jackson and Chris Burdock, and Assembly Member Robert Smullen. So I'm excited to go forward, and I'll let you start off on this conversation, Senator.
Great. I'd also like to welcome and recognize my Senate colleagues. I believe we have Senator Harckham, Senator Mannion, Senator Felder, Senator Persaud, and Senator Akshar, who are joining us today. And we also, the Senate will designate Annette Hiley as the recording secretary for purpose of taking minutes. And I'd also like to welcome our final senator, Senator Martucci, who is also joining us today. Should we go over what we cover as a part of this subcommittee?
Do you want me to, I don't know if you want me to start, if that would be easier. It's up to you. Okay, I look forward to working with you, of course, and the members of the conference committee to secure an on-time and both balanced budget. With the stresses of the past year, more New Yorkers than ever have been struggling with their mental health. This system has been starved for a very, very long time. And I hope when our work is done, Senator, we have enacted a budget that makes a real investment in our mental health system. So do you want me to continue? Okay, so at this time, the areas that are covered by this subcommittee include the Office of Mental Health, the Office of Addiction Services and Supports, and the Office of People with Developmental Disabilities, the Justice Center also for protection of people with special needs, and Developmental Disability Planning Council. Also, pursuant to the Public Officers Law, the Assembly has appointed Kim Hill, our good friend, as recording secretary. Sorry. As recording secretary to keep minutes and to publish the activities of the conference committee at the end of this process. So I'll let you introduce now.
Great, thank you so much. And as we go through this process, there are some things that are still open at our table and things that we have come to agreement on. So I will report out on the open agencies at our table that are considered open are the office, and I kind of repeating what the Assemblywoman said, the Office of Addiction Services and Supports, Office of Mental Health, the Office for People with Developmental Disabilities, and the Justice Center, all things that we will look forward to negotiating moving forward. And Assemblymember Gunther can speak on what has been agreed upon.
The Assembly and the Senate had some work to do on reaching a three-way agreement in the Article 7 language proposed in the executive proposal. The Assembly has included the following new Article 7 languages in one House budget resolution and would like them to consider for enacted budget. Develops 2 suicide prevention programs for high-risk groups. One program would be for the Latina adolescents, Black youth, members of the LGBTQ community, and rural communities. The other program would provide suicide prevention services to veterans, first responders, law enforcement, and the correction officers. Authorizes and fundings the Human Service COLA beginning April 2021, which is so important to many of our low and middle income women. So we've been fighting for this for a very, very long time, and we'll hopefully will be successful during this budget cycle. I'll let you go again.
Thank you. So now I know that we can offer some time for our colleagues in the subcommittee. If anyone has opening remarks or something that they would like to share now in terms of their priorities, I will take from the system they use for the budget hearings, and maybe we'll do Senate Assembly if that works. So I will call on one of my colleagues in the Senate, and I see Senator Harkam has got his hand up. Why don't you go first?
Thank you, Chairwoman, and want to thank you and Chairwoman Glick. It's great to be here with colleagues from both chambers, so many dedicated individuals who are committed to serving really our most vulnerable residents. And just speaking on the OASIS side of the shop, the pandemic has been, really decimated our substance use disorder patients. Anxiety's up, overdoses up through the roof. So we have a lot of work to do, but I think we also have some opportunity here to once and for all truly make investments in our services for our most vulnerable populations, particularly folks who've been so decimated. And these agencies have been cut year after year after year. So, some of the things that we're recommending is restoring 20 million in cuts, including the COLA, the 1% COLA that we heard. We are supportive of the proposed merger with OMH and OASIS, but we're proposing language with guardrails to really make this a patient-centered merger and not just something for administrative savings. Order to allow billing for peers for telehealth, parity for telehealth for office visits, strict guardrails around the opioid settlement funding coming to New York to ensure that it goes right to treatment, finally getting prior authorization for MAT, Medicaid done right. Last year, there was an agreement that was, to many of us, not administered appropriately. So we have legislation in there about that. And the dry appropriation for the federal block grant that is coming our way so that this legislature can put our stamp on what we think those priorities are. And lastly, the integrated license, again, is a good thing so that we can treat patients holistically, going to one treatment provider rather than going from doctor to doctor to doctor. So thank you very much, both chairs, and look forward to being part of this process.
Thank you, Senator Harkam. Over to the Assembly.
So other than that, we have additional resources for the Dwyer Veterans Peer-to-Peer Services, also restoring 5% withhold funding for non-residential programs and Medicaid cuts for DD people, ensuring Rockland's Children's Psych Center remains open. I'll repeat that one, expanding access and increased capacity for substance use programs, including Medicaid assisted treatment. Right now we have I think we have Missy Miller, who is also the minority chair, is next to speak.
Thanks, Aileen. Yeah, we would love to see funding for the OPWDD population. I stressed again and again and again ad nauseum during the pandemic how this population was, if an afterthought, that was being generous. They just weren't being considered at all. And it's continued even in the reopening phases. It's continued in the vaccine distribution. So they've really suffered. They've really, and in addition, allowing, the same as the nursing homes, COVID positives back into these group homes, creating an enormous number of staff fatalities as well as residential individual people. So we would like to see some agreement on funding, certainly for PPE and for the programs. A lot of these people have taken a hit and have regressed, and we really need to get funding back into there. It's in a dire situation.
Senator, should I just go through my group if that would be okay?
Sure.
Okay, so the next, I think, hand up was Phil Steck. Are you there?
So from the assembly perspective, one of the most important things is to make sure that the opioid settlement fund does not displace money that's coming to Oasis from the general fund. Frankly, we do agree with Senator Harkam as to that the Senate language does do a good job on describing what the money should be used for. However, we would like to add in to make sure that this does not in any way displace money from the general fund. This was supposed to be on top of the already limited funding that Oasis has. Second point is, at this point in time, we do not support the merger of Oasis and OMH. There may be other ways to assure that the areas where mental health services and substance abuse services overlap, but the Article 7 language as proposed was far too vague and not really budgetary in the sense that it doesn't indicate any budget outcomes. So I would say that those are two of the priorities for the Alcoholism and Drug Abuse Committee.
Thank you. Dee Dee Barrett?
Thank you, chairs. As the chair of the Assembly Committee on Veterans Affairs, I have always felt that the way we treat our veterans is just kind of the signal of how we treat the rest of society. And we have seen across every sector of our state and country the epidemic of mental health challenges. And I feel like we need to start destigmatizing all of these issues by making sure that we're treating our veterans in the best way possible. And one of the most important programs that we fund is the Dwyer program. And that goes through OMH. It's the only program that funnels through there. And this year, the Assembly is asking for $6 million to start completing the coverage across the state. At the moment, there's only 23 counties and maybe I think 25 now. We added 2 last time. In all of the counties of New York that have Dwyer funding. So I'm hoping that we will keep that in, as well as all of the other issues that many of you are working on: substance abuse, suicide prevention, trauma, disorders. All of those things impact our veterans as much as they impact the rest of our society. And we need to, as always, lead by example here. So thank you so much for the opportunity to be part of this committee.
Mr. Smullen?
Thank you, Chair Gunther. I just want to also echo what Chair Barrett just said, specifically about the Joseph P. Dwyer program. Maybe some of my Senate colleagues don't know, but I retired from the Marines after 3 tours in Afghanistan. And for sure, PTSD and TBI are real. And it really must be brought out into the open. And I've spent a lot of time, I represent 5 counties, but I've spent a lot of time in about 20 counties across New York in support of this program. And I know it's very effective because New York doesn't have a cabinet level Veterans Affairs commissioner. And because of that, it becomes fractured. And across all of the counties, there's some have Veterans Services officers, some don't. And it's knitting together a patchwork. And this is a good step towards a key element, which is at the national level, preventing 22 suicides a day by veterans. And I just really do, I urge everyone to take a serious look at this because it's very effective. The program, peer-to-peer is the way to go. It's a very effective treatment thing. And along with the recent legislation we just passed regarding veterans courts, I think will go a long way in meeting what's really the after effects of the 20 years since September 11th. We've had, almost 5 million veterans serve overseas in those 2 conflicts in Iraq and Afghanistan. and many of them are New Yorkers. And I think it's a really good program, and ask that you can carefully consider it. Thank you.
Thank you for sharing your story, and thank you for your service. And we'll do whatever we can. Okay, the senator, I think we've gone through everybody.
Sorry, Chairwoman, did you get Councilmember Burdick? I see one more hand.
Oh,
raised.
Mr. Burdick, I didn't see you. I'm so sorry. Sorry, Mr. Burdick, Chris.
Quite all right.
Go ahead, so sorry.
And
I'm,
no
I missed that
apology.
little yellow hand.
Okay. Well, I first want to thank Chair Gunther and Chair Brook for assembling this conference committee. And as a new member of the Assembly, I'm really honored to have an opportunity to participate, and you're availing me the ability to speak on it. As Chair Gunther had mentioned, these areas in the budget have been starved for years and years and years. And there really seems to be, from everything I'm hearing, a real consensus in both chambers that we have to do a great deal to make up for all of those years of starvation and austerity budgets. And I'm going to make a suggestion, with all due respect, that may seem to be outlandish, but I honestly do not feel that it is.
Okay.
And that is that I have a chart, and I'm sure that the senators have one too, that provides a table of the financial side of affairs, Assembly and Senate, and it identifies the differences. And I would respectfully suggest that we take the higher of the two, in each and every instance. I honestly do not feel that that is something that is outlandish or is breaking the bank. This is such a relatively small portion of the overall state budget. And it is something that, as Senator Harckham has said, this is among our most vulnerable populations that have been hit so hard by the pandemic. So I respectfully suggest that we really give serious consideration to that. And there are not that many areas of difference between the two chambers. And so I don't think that we're going to find that that's a terribly difficult prospect. I want to, as a member of both the Veterans Committee as well as the Committee on People with Disabilities, I also want to give my support to the Dwyer program. And in terms of key points that I'm coming to it from my vantage as a member of the Committee on People with Disabilities, I think it's so important that we ensure that we have access to healthcare, that we have the support needed for residential services, and Assemblywoman Miller had mentioned that in her remarks about how much those that are in residential settings have suffered through the pandemic. I also am grateful to see that there seems to be support for keeping open the Rockland Center. And though it's not in my district, it's something that's in my region and something in which I think is very important. And again, I want to extend my thanks for the opportunity to participate in this conference. Thanks very much.
Mr. Benante?
Thank you. There we are. Thank you to the chairs and the staff for bringing us together so promptly after both houses passed their one-house resolutions. I am pleased to see that both houses have paid a lot of attention to the mental health of the people of the state of New York. We are, as my colleagues have said, experiencing some very difficult times. There are so many people now suffering from mental insecurity, if I could call it that. We had a mental health problem in the state before the pandemic, but now it's just burgeoned. And people with disabilities, whether they're physical disabilities or intellectual disabilities, are facing an even more difficult time, and have been ignored in many situations, and are bearing the brunt of the pandemic. So I think both houses have recognized this and have put forward proposals that, as my colleague just said, are very, very similar. We don't disagree very much. I like my Westchester colleague's suggestion that we take the higher number in each case. And each house has proposed a couple of different things that need to be considered by the other house and perhaps adopted by both houses. For example, I have put forward, and my house has adopted a $10 million fund to be used for additional opportunities for residential opportunities. And I'd like to explore that with my colleague, Senator Mannion, to explain why I put that forward after having conversations with the community, and how they see the need for some additional types of residential opportunities, and perhaps we can do something with that. And I see in the Senate bill some language about requiring that everyone get broadband. And I think that's a very good proposal. I attended a press conference called by one of your senators, and we didn't put that language in, but we did match you. We did put in $900,000 to finance that. And I think your language is good language and ought to be adopted. But together, as I look at the list, we've opposed the consolidation of the IBR facility in Staten Island. We have both wanted to keep the human services COLA across the board. We put money back in for care coordination organizations. We both are concerned with some of the Medicaid reductions and rejected that. So by and large, we're on the same page, and I think we can resolve our differences and then negotiate with the executive branch as a united front. I noticed that you do have some money in for legislative ads, or we do not have that, but I commend you for doing that, and I think we should do the same thing, because I have had many not-for-profits approach me and say that, you know, we can't be sure that we're going to be funded, and please make sure. So I think that all of the legislators should get to a Chair Gunther and to me and to the other Chair Steck and Chair Barrett. If they are concerned about some particular organization, bring it to our attention so that we can discuss it with staff and find out what the status is. I know I have a couple in the OPWDD area, and I'm sure you all have these, but I guess we should do this quickly and discuss this with staff and see how these things have been covered in the past. There's some fear in some cases because what they don't always understand is some of these are funded by the Senate, some of these are funded by the Assembly, and there's a panic, well, it's not in your budget. Well, it's not supposed to be in our budget, it's a Senate ad or whatever, and so we'll have to straighten that out with staff.
Thank you very much, Tom.
And
Thank
so
you
I
so
just want
much.
to say thank you for bringing us together, and I look forward to working with everyone here on going forward
Thank
and
you.
solving this as quickly as possible.
Senator,
Thank you so much, the Assembly. Next, we'll go to Senator Akshar.
Madam Chairwoman, thank you so much to both of the co-chairs. I thank you as well for bringing us all together. You know, I've said this often, there are certain issues in Albany that transcend politics, and the work that this conference committee is doing is certainly some of those issues. That really doesn't matter if we're Republican or Democrat. This is an area, I think, in which we can all come together and advance good policy and a good spending, good responsible spending plan to help the most vulnerable New Yorkers. Madam Chairwoman, I would just, I have one question and then I would make a couple of points. If either of you could answer this question. In terms of dealing with the opioid epidemic, in terms of new funding, besides the settlement money that we are getting, how much money are we putting in to address that particular issue? Can someone from the staff or either of the co-chairs answer that question?
We can have staff look at that if you want to do your comments, and then we can come back to it.
Yeah, that'd be great. And I don't need an answer right now.
And if I may, Senator, there'll be another close to $100 million coming from the federal government, specifically to address COVID-related issues like the pandemic. And that block grant will be going specifically to OASIS.
Okay, let me address that if I may, since Senator Harkin brought that up. If I might suggest to my colleagues in both houses, I think it is imperative as we spend that block grant money that we listen to the community-based providers. A lot like you're doing in the Senate's one house in terms of administering the settlement fund. You're creating this task force, right, or this advisory council to opine about spending that particular money. I think we would be well served if we did the same thing. I am not pleased, with all due respect to my colleagues, that there are no minority appointees on that advisory council on how we spend the money. I think we should reflect that the minority members in both houses do in fact represent over 12 million people in this great state. And I think it is something that we should consider. Let me address just the Joseph P. Dwyer program, if I may. I am glad to see that was restored, but Assemblywoman Barrett makes a very good point. They're at 6 million, we're at 4.5. We should meet them at 6 million because the program is so incredibly important to the people that we're currently providing services for, but we should in fact be expanding this program the best we can do. Let me address the crisis intervention training. The state Senate should be ashamed of themselves that we are not even close to where the Assembly is. I want to commend them. They're at 3 million specifically for crisis intervention training and 10 million to deal with a whole plethora of issues. I would respectfully offer that rather than pass regressive policies that I have viewed from time to time to be anti-police, we in fact should be joining our colleagues in the state assembly, meeting them at that $10 million mark to actually train members of law enforcement the way that we believe they should be trained. The $3 million, of course, is a great number for CIT. I would just beg of my colleagues to not go back to the numbers that we have seen in recent years. I'm looking at a 2019 number. It ended up being 412,000, far short of the 3 million that is currently being advanced. And then one last thing, if I may, Senator Harkin, you and I have discussed this ad nauseum. In terms of jail-based substance use disorder programs, we're at 3.75 million. A couple of years ago, that analysis said we should be at 12 million to actually provide the service statewide. I would just implore my colleagues in the majority in both houses to look at that actual number of 12 million so we can do the very best we can. And remember, I'm a former member of law enforcement, and I'm the first person to tell or first person to say to everyone, that would be a $12 million well spent dealing with people while they're in the confines of a correctional facility and getting their life back on track so they can be productive members of this great state. With that, to both the chairwoman, I appreciate your indulgence and the time you've given me to offer some thoughts.
I think that your suggestion to increase the CIT is really very, very valuable. We have really kind of shortchanged it for a long time, and it's such a preventative method for so many. And thank you for your service as a police officer, and I'm sure you bring a lot of valuable knowledge to all of us.
Thank you, Madam Chairwoman.
Senator Akshar. And then finally, we'll go to Senator Mannion.
Thank you to both the co-chairs. I appreciate it. Just to echo a couple things, which would be, we absolutely have to reject these across the board cuts and prevent, the deferral of the cost of living adjustment. A couple other things is that we must raise the wages of our DSPs. Our organizations have a very challenging time retaining and recruiting people who provide these absolutely necessary, important services. I agree with my colleague, Assemblyman Avenatti, that individuals have to have the flexibility to choose the services that they need, and that includes residential services for people in the disabilities community. Additionally, we have to make sure that these federal funds are used in the right area. They're used to help support the most vulnerable. And just one thing about what we advocated for in the Senate would be many people regarding the CDPAP program and the changes that are proposed there and the dramatic number of fiscal intermediaries that were cut down. We've advanced language to try to make sure that the people and the organizations that have been providing these services for such a long time and are embedded in the community still are able to provide that service. I really appreciate the opportunity to talk. Those are some of my thoughts. And thank you for all the good work that everybody's doing out here.
Thank you, Senator Mannion. And we just have a few more back from the Assembly, so I'll hand it back over to Chairwoman Gunther.
Missy Miller, do you want to speak again? Okay.
Thank you. I also want to add that, I know there's been a lot of uncertainty, so much transition over the last few years from traditional Medicaid services, like case management services into the CCOs. And there's a lot of uncertainty. There's a lot of still transitioning, but everybody was moved into the CCO models. We need to fund that. That needs to be continued. They've had federal cuts. I myself have questioned the CCO arrangement, their organization, how they bill. There's when I say there's a lot of uncertainty, it's around that, but yet they're still responsible now for all of the individuals, like my son, that is they're administrating and managing his coordination of care. That requires money. So we have to, I know the Assembly includes money for that, but the Senate does not include any. So I just think it's something that might be looked at again, so that people aren't facing service cuts, or if they're having to reduce their staff, or it affects ultimately us. It affects our loved ones. Thank you.
Thank you. I think Phil Steck would like to speak again.
Did you unmute me? Yes. So very briefly, in answer to part of Senator Akshar's question, OASIS has scheduled a meeting with the providers in the area concerning the application, concerning the process of interacting with the federal government and determining how the money that's coming from the federal government will be utilized. So we're certainly going to be monitoring that process. My understanding is it goes from us back to the feds, and then the feds take it into account and then make a determination as to what the money will be used for. But we're certainly on top of that, and it's an excellent opportunity to get money into this space because, as we all know, it's been historically deeply underfunded.
Mr. Abenante?
Yes, thank you. First of all, my colleague Assemblywoman Miller, I think, let me highlight to you that there are different numbers from the Assembly and the Senate, but the Senate does put money in for putting money back for the CCOs. So we're on the same page. You make a valid point. We should agree on that, but we're not that far apart. But there is another issue that comes about as a result of what you just said. And that is, we need to find a way to make sure that we put money back in. We don't see administrative cuts, despite the fact that the money is in. And the CCO cut is basically an administrative cut, and we're putting the money back in. So we're going to have to talk to staff on both sides to see if there's some way we can develop some language to ensure that this money goes to where it's intended. It's always a difficulty because the executive branch has a tremendous amount of discretion. But I think it's an issue that we should take a look at because they've indicated they want to cut this. We're putting the money back in, and we've got to make sure that they actually spend the money. So
thank you very much, Tom. Thank you very much. So I think this was a very productive meeting. I would ask anybody that has any additional questions or suggestions, to please email my office. And I know that we haven't received all that we really wanted in the DD community and the mental health community, and also in the OASIS community. We'll continue to fight. And I think with my other chair from the Senate, that, you know, we can put our heads together. I think at this moment in time in our New York State community, funding for all of these issues are so important, probably more important than giving out capital money or This Is Human Life. And our DD community has been suffering over the years. Our MHU community has been suffering. We haven't really been giving the money that they adequately need to provide the services that have increased. People are living longer, and we have to make sure that their needs are met. So I'm hoping that, you know, an increased awareness to all of our members of the Senate and the Assembly will help us lobby for increased funding for all of these things, both in the DD, MHU, and OASIS community. So I thank you for your service, Missy Miller. And I always have to say thank you for being one of my co-chairs. Really, she's amazing. And thanks all of you for being here.
And I'll round out just to end today and echo the Chairwoman Gunther's gratitude to everyone for joining us, and to my fellow senators and related committee chairs, Senator Harckham and Senator Mannion. You all, I believe, represented us very well in some of the things that we think are incredibly important. And I think the one thing we all agree on is that this is not the moment. If ever there were not a moment for austerity, it is now. We've seen need skyrocket. We have seen folks not getting the services that they need. And so we have to be the courageous ones to have these hard conversations and really insist and push forward for making these vital investments in our communities. So thank you all, and thank you as always to the staff for keeping us going and making sure we're running on time. And we will look forward to reconvening for our next conference committee meeting.
Bye, Erin. Thank you, everybody.